Now to our focus segment. Joining us via Skype from Calabar, the Cross River State capital, is the National Vice Chairman of the Forum of CEOs of all primary healthcare agencies and boards in Nigeria, Dr. Betta Edu. Thank you for joining us.
You're welcome.
Now, what is the true situation regarding maternal and child mortality in Nigeria?
Well, like you rightly stated, Nigeria is one of the countries that have made the least improvement in maternal and child health over the past decade. And we cannot all continue to sit down and watch. Like you stated, every single day, 145 women die from cases related to childbirth. And of course, our children, over 2,300 children, die every single day. If this was a plane crash, if this was a bus crash, I'm sure everybody would be concerned and everyone would send in a message. But remember, these are numbers, these are lives, these are sisters, these are relatives, and nothing much is being said about it. To make matters worse, the health system as a whole is not strong enough to be able to really withstand all the issues that arise with maternal and child health. And that's one of the reasons why we continue to push for health system strengthening. So the numbers are really, really very terrible, and Nigeria must take very bold steps to ensure that we can reduce maternal and child death at least by half in the next 2 years. We're happy with what the National Primary Healthcare Development Agency and its boss, the ED, Dr. Faisal Shaibu, is doing to ensure that all the states can come on the same page. We were part of that declaration, and we have been told to do same in our state, set up a technical committee who will sit over this and every day ask questions. Why did this woman die? Hold someone accountable. If we ask questions, if we increase the number of times we go out to monitor, to supervise, to hold people accountable for these deaths, then we would at least go a long way to reduce it. And really, it's not just about people or staff, but the community has to be involved in all of this.
Now, it's good that you talk about, steps being taken, but let's talk about funding and the budgetary allocation. How committed are we as a nation to, putting our money where our heart is?
Okay, first of all, I think the budgeting system of Nigeria is kind of a bit faulty in that we do just a rollover budget from year to year. We are not budgeting based on the results which we want to see. And I think we have to become more strategic in the way we budget and in the way we purchase healthcare to enable us achieve universal healthcare. It's a sad thing that the law in 2014 was passed to ensure that basic healthcare provision funds are provided in health facilities, at these primary health facilities, so women all over the country, children all over the country can have access to healthcare. But these funds up till this minute have not been sent into states, and the implementation of that very lofty idea is yet to begin. So really, I think Nigeria needs to do more to put its financial resources where its mouth is, where its heart is. This is an issue, it's burning all of us. All of us have been victims of this problem in one way or the other. And so it's time we face it, and we face it being true to ourselves and putting in the right funding that is required to make things work. But beyond that, I'm sure we should also look into the issue of the human resource, which is very, very important. And we must critically look into the issue of ensuring people in Nigeria if we must achieve universal health coverage.
Now let's bring it home to you in Calabar. What is the Cross River State government doing? What arrangements have been made?
Okay, so first of all, for us, we're looking at it as a system, and we are trying to address it as such. So I'm sure you heard that last year we were able to, as a state, flag off the Ayade Care, which is the state health insurance scheme, and the operationalization of that scheme is on the way. But more importantly, the government recently approved the employment of 1,000 health workers, and at the same time, we're working on our facilities, our primary health facilities, to upgrade them to be able to deliver quality health services to our women. Beyond this, we've been engaging seriously with communities to see that people can take responsibility of ensuring that these women, when they get pregnant, they don't only come for antenatal session, but they deliver at the health facility. Because of course, if there's an increase in skilled birth attendants, then there will be a decrease in maternal mortality. And of course, for our children, immunization is very, very important. And so we've been able to do a lot, beginning from the technical committee, which every day sits down in a kind of coordination meeting to ensure that people, children all over the state receive immunization. We've had challenges with the influx of over 20,000 refugees and asylum seekers from southern Cameroon due to the issues which they're having there right now. But we've been able to surmount the pressure, and we're happy that most of those children have had access to vaccines. However, most of the orders still deliver in the camps.
All right, Dr. Edu, very quickly, Nigeria is 5 months away from being a polio-free country. How can we sustain this drive, in a few words?
Okay, so I think if we can strengthen surveillance, if we can close the immunity gap, and we can put in a little more resources into it, we have our strategies right. We've done a lot. At least so far this year, there have been no case of wild polio virus type 1. We've just had a few cases of circulating vaccine-derived polio type 2 and 3. But if we can just continue to strengthen surveillance all across the nation, and at the same time ensure that we continue with the strategy in Borno and those flashpoints, then we should be ready to have that certification in the next 5 months. But
thank you very much. Thank you very much, Dr. Betta Edu, National Vice Chairman of the Forum of CEOs of all primary healthcare agencies and boards in Nigeria. Thank you very much for joining us on the program.
You're welcome.